The value in the Clinical Simulation Center is that we provide an environment for our students to really work on their skills, to really work on their basic day-to-day skills that they're going to need, and for those critical skills that they may not have a chance to practice before they're really necessary.
From a recruitment perspective, the Clinical Simulation Center makes our DVM program as a whole seem very attractive. It is a very unique program in veterinary medical education in that it starts the hands-on learning right from the very first day.
As a student, personally, it was really helpful to me, even just starting day one, first semester, to come in to remind myself really why I'm here and really to pair my book learning with hands-on experience that really solidified what I was learning. The Clinical Simulation Center is a place for students freshmen through fourth year, faculty members, residents, anybody associated with the vet clinical sciences can come and practice different procedures at their own pace, their own time, anytime.
I actually had my resident go down to the simulation lab, and for her, I think that actually improved her tissue handling tremendously.
In the skills lab, we have quite a few models. Some we have purchased, some of them we create.
My favorite model that I've used would probably be the catheter model. Even though that's a basic model, I feel like that's a skill that you can use over and over and over again, and I try to use that as much as I can.
We also have an OR/ER that we're able to run anesthesia simulation and critical care CPR simulations where our students can learn to work as a team. They can have an arrhythmia, they can call a timeout, they can sort out what the arrhythmia is, and then choose to treat it and see how it responds. And if they choose the wrong treatment, they see that response and we're able to help them understand the impact of their actions in a really safe environment. We can go back, redo it, and get the right outcome, and so they're really able to develop that confidence and that ability.
I really have liked working with the horse model because that model really allows people who don't think about maybe having to palpate a horse for a colic to really think through, oh wait, what am I feeling? Where are all the body parts?
And with our calf and cow model, they're able to practice dystocia management. And in this case, we have a simulated client who portrays the owner, again, based on a real client.
Just having used Letha's spay model, where you can step by step go through the process and get the process of a spay in place in your mind, is super invaluable.
My first spay was on this greyhound named Stoppy, and I was terrified. I think everything went really well, but she was really painful the day after. The whole time it was like, well, could I have done a better job or not? Ultimately, I probably could have if I had more practice and not had to do my first spay on a live dog, but it was really hard to see her so painful after surgery.
We have the opportunity to train them in basic surgical skills and then advancing those progressively through the course of their training program. And they have the opportunity to really come in and advance those skills as far as they want through our optional clinical skills lab program, or what we call Open Lab.
Open Lab is anything that the student wants it to be. We have models that can mimic pretty much anything that you want to learn, and we have all the books and all of the teaching material for you to practice something. If you don't know what you want to do, we can give you something. But if there's something that you've always wanted to try, we can also do that as well.
Of all the things that we do during a day with a prospective veterinary student, spending time in the Clinical Simulation Center, especially during Open Lab, is the one thing that makes them feel most like they're really going to be a veterinarian.
It gives you a time to get away from studying and away from sitting in a lecture hall. So I think in terms of mental health, it's a great addition, but it also allows veterinary students, I think, a leg up when it comes to their summer experiences, because we have learned gowning and gloving, we've learned surgery skills, we have all these models for all these different scenarios that you're going to run into if you're interning at a vet. And if they ask you, have you had this experience, you can say, well, I've practiced this on a model and I've done this and this is what I know, instead of saying, no, I haven't seen that yet. And for me, that has been invaluable.
We began using TAs in the Open Lab. And the reason that we came to that was we realized that it was far easier for learners to work with their peers to get feedback.
I can really relate to the person that I'm working with. Yeah, I know this is frustrating. This is what I did. Here's my trick, and this is how I'm still getting better at it.
It really helps to be able to talk through with somebody who has had additional training, who can walk you through, okay, so these are the fundamental steps of what you're gonna do, but here's how you need to think about it. Because that's where you really transition from being somebody with a lot of book knowledge to being somebody who can think through a clinical situation.
So we work together frequently on their skill set and make sure they understand both the skills that they are teaching, be those surgical skills or diagnostic skills, and that they understand how to teach effectively for their peers.
And what's important to remember is that, yeah, we're peer taught, that it's me teaching another student, but there's always somebody else in the room for the really hard questions or for the clinical application questions.
Dr. Carey and Letha are excellent resources for us. They are basically just walking textbooks for me.
We are blessed to have donors. Without them, we wouldn't have half the models that we have, whether they be alumni or people who have come by and actually see what we're doing and the difference that we're making in our students and have donated and thankfully helped us get some of these bigger models.
I want to see the simulation lab grow by just continuing to stay current. Veterinary medicine is a field that is expanding every single day because people want to do more for their animals. And because of that, we're able to incorporate more and more science and technology into what we do. And I think it's important that our university, our training programs, our simulation center keeps up with that. That's how we are going to continue to create the best doctors possible. So I just want to make sure that it continues to grow and be the fantastic place that I think everybody in my class would agree that it is.